4 warning signs that you need to go to your doctor. You know it's time to check in with your doctor if you're feeling absolutely dreadful or if you're due for your yearly examination. But many of the major signs of poor health tend to fly under the radar and are wrongfully chalked up as just being common with age. I'm here to tell you that this is not the case. And if you're not feeling or looking your best, an underlying health issue is probably to blame. That's why today I want to share 4 common yet surprising signs that it's time to see your doc. The first, skin tags, rosacea, which is adult acne. Skin tags are not a normal finding of aging. Personally, when I was in my 40s, I had skin tags in my armpits and down in my groins. And I actually wasn't too worried about them because, interestingly enough, the men and women that I was operating on for coronary artery disease also had these skin tags. And I was told by my dermatologist friends that, oh, that's just a normal part of aging. Can you imagine my surprise when I went on my program and began losing weight that my skin tags dried up and fell off? Seriously, it's the most wild thing I've ever seen. And I have tons of patients who follow my program that their skin tags dry up and fall off. So what are skin tags trying to tell you? Skin tags are trying to tell you that you have an elevated insulin level, and you most likely have an elevated insulin-like growth factor, IGF-1. These are both growth hormones, and there is nothing in us that we want to grow, I assure you. So this was an outward sign that I was growing things. Now, they also correlate very well with skin tags growing inside your colon. We call them polyps. And it's very unusual for me to ever see anyone with a colon polyp who doesn't have an elevated insulin level. Women, if you have adult acne, rosacea, I can virtually guarantee you that you have an elevated insulin level. Men, if you are told you have a big prostate, or if you're getting up a few times to go to the bathroom at night, or it's getting harder to start your stream, I got news for you. Your prostate is being stimulated to grow by an elevated insulin level. And just to reiterate, the last thing you want as you get older is an elevated insulin level. Elevated insulin levels correlate with developing cancer. They strongly correlate with developing memory loss, dementia, Parkinson's, and Alzheimer's, none of which you want. So these are all warning signs that at the very least, have your doctor order a fasting insulin level. It's usually paid for by insurance. If it isn't, it's about $8. And make sure your insulin level is well under 10. I prefer 6 and less. That's the first warning sign that you can't ignore.